The hospital has this group called PFAC, Patient Family Advisory Committee, maybe it stands for. And so we went through them. We advertised on the website, and then we have someone here who is part of the SPORE support unit, part of our method center. So she helped sort of put the word out for any patients that were looking to partner with researchers. But yeah, the two patient partners we ended up inviting to join our team both had seen the advertisement on the website and applied that way. We had quite a few responses because I think the topic itself was kind of novel and interesting to people, and people could understand it. And a lot of people have had at least one surgery in their life or know somebody who has. But I think the challenge was sorting through them, because I mean, obviously it's a volunteer sort of position. I mean, we give our patients an honorarium, but it's not their full-time job. So it's how to be rigorous and make sure you have the right fit without doing a full-out job interview, hiring process. And so I think it was challenging, kind of going through all the applications and meeting with people and figuring out how to assess who would be the best fit for your team, where both the research team and the patient partners could get something out of it, so it's a win-win situation, without being super, I don't know the word I'm looking for, but a whole a series of 3 interviews and send me your CV and all this stuff. We didn't do that. It's more just we met one time with people and talked to them, but it was hard to find that balance between finding the right people in a rigorous way, but not being so intimidating and scaring people away from this position that's not their full-time job. So we had people just basically asked for them to indicate their interest, and then we set up meetings based on what people had written to us. We set up meetings with people who we thought sort of would be a good match, and we decided that we would just have more of an informal conversation and a relaxed setting, just kind of around the table with our group, and we didn't have I don't know, a piece of paper with we weren't checking boxes or anything a job interview, and we just kind of I don't know, just tried to keep it as friendly as possible, friendly but still professional, and hope for the best, I guess. And we ended up getting lucky and finding 2 really awesome people, but I think it was still hard to tell people no, because they are kind of volunteering their time and they want to help, so it's hard to email them and be oh, actually, thanks for your interest, but no. But yeah, so I found that hard. I mean, we didn't get any negative feedback or anything from people, but I personally just found it hard because I wish we could take all the patients that want to partner with researchers, but I guess in order to make sure that it's mutually beneficial and productive, you have to make sure it's the right fit. And then we also set up a terms of reference between our group and our patient partners to outline what everybody's responsibilities are, so the research team and the patient partners, and just sort of be clear on all the roles and process. And both of the patient partners said they really appreciated that, because they know what to expect from us, and they also knew what we would like for them to do, and then we also specifying they would receive an honorarium, and we would cover their travel costs and stuff like that. And then we also worked to set up meeting times that were best for them, so because one of them's a student and one of them has a full-time government job, so there's only certain days and times that can work for meetings and stuff, so we tried to base it around them and what they want as much as possible.